Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Febuxostat. Its brand name is Uloric. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Febuxostat is an xanthine oxidase inhibitor which works by decreasing serum uric acid levels. In terms of indications for use, it's indicated to be used in the treatment of gout associated with hypouricemia. Before somebody was to use Febuxostat, there is one contraindication that they must clear, that being that they cannot use this medication with azathioprine or mercaptopurine, and there's also some precautions and warnings that they should be made aware of. Cardiovascular thrombotic events, such as non-fatal myocardial infarctions or heart attacks, cardiovascular deaths, as well as non-fatal strokes, have been reported with the use of this medication. Serious skin and hypersensitivity reactions, such as Stevens-Johnson syndrome, drug reactions with eosinophilia, and systemic symptoms, also known as DRESS, and toxic epidermal necrolysis have been reported with the use of Febuxostat. The medication should be discontinued at the first sign of any of these appearing, and if a patient had a similar reaction to allopurinol, they should use Febuxostat cautiously. Use is not recommended if a patient has a condition that increases urate formation rate. An example of this would be a malignant disease. Fatal and non-fatal hepatic failure and elevations in liver enzymes have been reported. Monitoring for this would be recommended, and permanent discontinuation of therapy may be recommended. If the liver enzyme ALT is raised above 3 times the reference range, and serum total bilirubin is raised above 2 times the reference range, without alternative etiologies, this would increase the risk of liver injury, and discontinuation may be warranted. It should also be noted that an increase in gout flares may actually occur during the initiation of therapy. Once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use Febuxostat or Uloric, they can expect to receive their dose in tablet form. It's available in a 40 as well as an 80 milligram tablet. If somebody is using this medication to treat their gout associated with hypouricemia, they would typically start off with a dose of 40 milligrams once daily. If serum uric acid levels of less than 6 milligrams per deciliter are not achieved within the first 2 weeks, then the dose may be increased to 80 milligrams daily. Oftentimes, patients will use an NSAID or colchicine with their Febuxostat upon initiation of therapy. Continued use of these medications may be warranted and useful for up to 6 months. There's also an off-label use for this medication that can be used in patients that have high uric acid levels who are receiving chemotherapy and have intermediate to a high risk of tumor lysis syndrome. They may use 120 milligrams for 7 to 9 days, starting 2 days prior to initiation of chemotherapy. An alternative dose would be 60 milligrams for 6 to 14 days, starting this time 24 hours before chemotherapy. As with all medications, there are some side effects or adverse reactions that patients may experience while using Febuxostat, so I'll go over some of those here now. Rash comes in between 0.5% and 1.6%. Greater than 1% of patients may experience diarrhea. Nausea can happen up to 1.3% of the time. And joint pain comes in around 0.5% to 1% as well. Some more serious side effects would be cardiovascular death, or myocardial infarction, or heart attack. Some skin reactions that we discussed, such as drug reactions with eosinophilia and systemic symptoms, aka DRESS, Stevens-Johnson syndrome, or toxic epidermal necrolysis. Abnormal liver function comes in between 4.5% and 6.5%. An acute gout attack, rhabdomyolysis, and finally a cardiovascular accident. That's all we're going to talk about today with Febuxostat or Uloric. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.